The Philippine Nurses Association of Nevada now brings you FILIPINARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello to all of you FILIPINARS followers. I hope you're doing great on this October day. Thank you so much for joining us. And as you know, the FILIPINARS is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, as a public service project, and it is in collaboration with PHLV Radio. The goal of FILIPINARS is to create awareness of the different health issues in our community and beyond. And we also feature different healthcare professionals and workers, as well as organizations who help take care of the patients and the public. So, October is National Pharmacy Month, and it is celebrated every year to recognize the contributions of pharmacists and pharmacy technicians to healthcare and the community. The celebration actually started in 1925 when radio stations across the United States broadcasted special programming to highlight the profession of pharmacy. And in 2004, after celebrating National Pharmacy Week for nearly 8 decades, the American Pharmacists Association recognized October as American Pharmacist Month, and it has been so ever since. So recently, October 12th was designated as Women's Pharmacy Day and October 19th as Pharmacy Technician Day. So this is a great time to recognize our pharmacists, our pharmacy technicians, pharmacy teams, and student pharmacists for the roles that they play in helping people live healthy lives. So today, we have invited 3 special guests in the pharmacy field. Please welcome Mr. Vincent Nguyen, Ms. Mylan, and Ms. Raquel. We call her Estrella Palispis. Welcome.
Hello.
Good. I hope we are really glad that you guys are here. So I am going to have you guys introduce yourselves and tell us a little bit about you. Our first guest is Mr. Vincent Nguyen. He's a PharmD.
Hello, Doris.
Hi.
Thank you for having us here on the show.
Sure.
So my name is Vincent Nguyen, and I've been a pharmacist for, I think just about 11 years now. That started, back to how it started, it was kind of from my childhood. I was always playing with chemistry sets, and it was my favorite toy set at home. And you remember Dexter's Lab, the cartoon?
Mm-hmm. Oh yeah.
Yeah. So he's always like mixing stuff, and has his little sister annoying him all the time. So I was kind of like, I thought I wanted to be that Dexter little chemist guy, right? And from then, also my grandma was a pharmacist in Vietnam, like during the war. Mm-hmm. But we're talking about Oriental medicine. Mm-hmm. But that kind of was running in the family already. So when I came to the States, it kind of felt natural to go that way. Plus, I didn't want to go into chemistry industry, so I wanted to stay in healthcare. And so that's the logical path to take for me, was to go into pharmacy.
Very good, and we're glad you're one. You took that path.
Thank you.
How about you, Mylan? Miss Mylan Dow is also a PharmD.
Yes, and I've been a pharmacist for 4 years, so not as long as Vincent here.
It's okay.
But similarly, kind of had that influence from childhood, but I wasn't sure at the time what pharmacy even was. But as I grew, I knew that I wanted to go into healthcare. And I had a very great role model in my mom, and she kind of guided me along the path and, slowly introduced me to the field little by little. And eventually I became a pharmacist myself.
That's good. Well, thank you. And Ms. Raquel Estrella Palispis, she is a pharmacy technician. Hi,
Hello, Ms. D. I've been a pharmacy technician for 16 years. And from the Philippines, I wanted to enter a field in healthcare, but since I cannot, coming from a nutrition department and then moving to the U.S., I have to start everything again. So I said I needed something that will help me penetrate the health services in a quick way.
In a quick way, yeah. And so you went to pharmacy technician school.
Do the diploma course for pharmacist tech.
Very good. Well, welcome all of you. Okay, so I think Vincent and Mylan, you both already shared why did you choose to become a pharmacist. And so is there anything else you want to add to those stories?
I couldn't, and I still don't stand the sight of blood. So that automatically takes me out of nursing and invasive tasks, or even I like talking to patients, but yeah, the sight of blood. I remember being volunteering to a dialysis center, and when I was like about 16, 17, and I saw this patient. She got up from her chair and she was still hooked up to her catheter was still hooked up, and she didn't realize that. So then when she walked away, it came out, and some sizable quantity of blood just like pooled on the ground. And I remember my last thought was looking at it.
You passed out.
Yeah, I fixated on it, and then the next thing I knew, I was sitting down in the chair, and then I asked the staff like, what happened? They said, yeah, you basically slowly fainted. so that's a fear that I have not revisited, and it's really hard for me to get over. So yeah, that automatically took me out of invasive procedures, and I think nursing. So I have a lot of respect for everybody who can deal with blood, and then not even flinch. That's a tough skill to acquire.
Good. Yes, of course. And Mylan, anything to add to your story?
I'm kind of the same as Vincent over here, where I was trying to avoid like body fluids, but not as dramatic of a story there. I just already knew, but I want to keep that direct, contact and directly helping patients. So it seemed like an ideal path to go down into pharmacy.
Very good. Very good. So how long does pharmacy training or pharmacy school take?
Oh, it takes, 4 years for pharmacy school is the standard, but you'll find that there are programs out there that will run for 3, sometimes even less, and they'll run through the summers and just basically condense everything down. As for undergrad, as long as you complete the requirements, it doesn't matter whether you have a bachelor's or not. As long as you complete the pharmacy school requirements, you can apply to their program and get accepted. So that can take anywhere from 2 to 4 years.
2 to 4 years, and that's for the bachelor's side.
Yes.
And then, of course, the both of you went to PharmD. So what kind of what added training was that, Vincent?
Yeah, that was 4 years. So like Mylan said, there are 3 year condensed programs out there. Even I think I've heard of 2 years, like extremely condensed and intense. I did the regular track, which is 4 years after either your associate's degree or bachelor's degree.
Okay.
So 4 years. The pace is still pretty intense, fast pace. I mean, you barely have time to work part time. Some people work part time, even full time, which I have a lot of respect for those people, because it's very tough to balance personal life and academic life.
Absolutely.
Yeah.
So PharmD, for those of you who are not familiar with the term, is doctorate in pharmacy, correct?
Yes.
Okay, great.
Yeah, it used to be that registered pharmacist was the degree, and then I think in the early or mid 90s it got changed. The whole program got revamped and renamed to doctorate of pharmacy, so PharmD.
Yeah, and that's pretty much the requirement now these days of a lot of companies, right?
Correct.
So, So, what are the requirements to keep up with your pharmacy license? And, let's start with that question first.
It depends on the states. For example, I went to University of Florida, for those Go Gators, for those who know. But the state of Florida, for example, has requirements where it's 30 credit hours every 2 years that we have to maintain. Out of those 30, for Florida, not for Nevada, but for Florida, for example, 10 of those need to be live credit hours. So that kind of makes people have to attend either live seminars or attend online, also live webinars online. For Nevada, we don't have that requirement, but different states, different requirements. So 30 credit hours, I think every 2 years is about the norm. Now, if you have more certifications, like if you're a nuclear pharmacist or consultant pharmacist, there's going to be extra credit hours associated with that. Did I miss something, Mylan?
Yeah, here in Nevada, they also make you take that credit hour for law. At least, I think it's just 1 hour and out of 30. So it's not much, but it is a requirement to renew your license.
For law, you said?
Yes.
The laws of the state for regarding pharmacy. Okay. Yes. Yeah, because it's kind of similar in nursing. We have a requirement. It's not every year, but it's every 4 years. Bioterrorism. We have a requirement, and I think it's the cultural diversity thing now that we have to undergo as well. So I was going to ask you, in nursing, we have what you call this compact licensure, wherein, if your state was participating in or is a compact licensure state, you have like different states where you can practice as a nurse. Is that the same in pharmacy or no?
In pharmacy, each license you get is for that particular state, and some states, or most states actually, will reciprocate that license, but you still need to study for the law portion of that state's and take the test for that before they issue you the license. And then you'll have to upkeep it with the number of hours and any continuing education requirements that state might require as well. So
good.
every state is just for that state primarily.
But there is a reciprocation, and the test that you have to take for each state would be the law, particularly for the state.
And sometimes it's not necessarily law focused. Like I know California has a very intense test. We still call it law test, but it's become a lot more clinical to the point where it's practically another NAPLEX, some say.
Oh, wow. Wow. Okay. So, Estrella, what is the function of a pharmacy technician?
Pharmacy technician, if we go to the layman's term, it's the other set of hands of the pharmacist.
Yeah.
So basically, we assist the pharmacist in most of the responsibilities.
Most of it.
Other than the clinical side of counseling and all those stuff. Those are exclusive for them.
So you put...
So we are the ones who coordinate with the refills of patients. We pull the stuff for them. I do compound too.
Okay. Yeah, compounding it, that's a different type of healthcare situation. So, yeah, that's good. And what type of training and certification would you have to obtain to become a pharmacy technician?
I think there's 3 paths for those who want to be a pharmacy technician. The first one is, I think you just have to do tech-in training, as in an OJT. You have to fulfill like 1,500 hours.
Yeah, on the job.
On the job training.
Oh, okay.
That you have to do within 3 years. Then you get your state license.
Okay.
I did the second one, which is the diploma course. It's a short, less than a year training. Then after that, you take the certification, the PTCB exam.
Okay, so that exam is state defined, or does it go, do you have to do it for the national?
It's a national
certification. So when you get certified, you get that certification, you can basically practice in another state as a pharmacy technician, correct?
That's how it is, yeah. And then now there are a bunch of certification that for specialization, but you still have to pass the PTCB, and then there are other certification, like if you want to specialize in compounding, you take that certification. If you want to do biohazard, billing and coding and all those stuff, there are different sets of.
Oh, so they're like advanced certification, right?
Even immunization.
Oh, really? Oh, my goodness. Oh, my goodness. Okay. So that's good. Thanks for that. So Vincent and Mylan, what area of healthcare are you currently practicing as a pharmacist? And can you describe your duties and responsibilities in that area?
So right now, I work in home health, and I've been here for quite a while. We take care of mostly patients who are already home, so outpatient, and usually these patients have some kind of chronic disease or something that requires them to have care for an extended period of time outside of the hospital or the clinic. So our role outside is to follow the patient, make sure they're following a care plan, dispensing the meds, and then we work with the nurses that go to their homes or work in our clinics to administer the medication for the patient and follow them either monthly, weekly, depending on their therapy.
And their lab work, right?
Yes, and of course, our nurses will, like their lab work, will review their lab works, and we work with their doctors to bring up any needs of the patient and adjust therapy accordingly.
Oh, good. Yes, I'm pretty familiar with that.
Yes, I'm sure.
How about you, Vincent? You're working in a hospital situation right now, right?
Yeah, so I'm currently in a hospital, at a local hospital, and more specifically in what we call a clean room environment. So for those who are unfamiliar, in the hospital, the nurses can give the medications bedside. Let's say you have something to reconstitute, then the nurse will just reconstitute it and administer on the spot. For more complex medications or medications that need more preparation, then we have in the pharmacy department in the hospital a clean room. So it's basically think of it as the probably the cleanest room along with the ORs in the hospital in terms of air, where the air is heavily filtered and you have to wear this astronaut looking gear before you go in there. And Estrella, Raquel knows this very well, and Mylan knows this very well too, because we've all done it. But you wear this astronaut gear, you go in there and you mix the intravenous medications, and all of this has to be done under very stringent conditions to preserve the sterility. To minimize risk and harm to the patients, and ensure that we have a quality preparation. So it's a meticulous work. So that's my role in the hospital. Before that,
and what other places did you work before?
Yeah, I was on the same side of the fence as Mylan and Estrella. So in the outpatient setting where we were doing home infusion. So again, we did have a compounding home infusion that does have a compounding element to it, and we rely heavily on help from technicians and the nurses out there to coordinate the care and ensure the best outcome for the patient, so that they have a good time doing their therapy, an easy time doing their therapy at home, and hopefully prevent them going back in the hospital.
Great. Yeah, that's good. Any other places you worked with besides the hospital and home care?
I did just outpatient compounding before, meaning like if you think of ointments and creams and lozenges and troches that a pharmacy can put together, so I did that too. So that's the non-sterile compounding part. In Florida, I did that. And so that is not acute care, but let's say some patients need hormone replacement therapy. Maybe some ladies are hitting menopause and need some progesterone therapy, but the commercially available products are not meeting their requirements and needs. So this is when a compounding pharmacy comes in, and we can make troches, lozenges, suspensions, sublingual drops on demand that are customized and to that patient's needs and lab work and symptoms, and make that specifically for them. And that's again another field of pharmacy. That both pharmacists and technicians can go in.
Yeah, I see those around town, right?
Yes.
In our town,
definitely.
we have a lot of compounding pharmacists around.
Yeah.
Mylan, besides home health, have you done anything else in the hospital or anywhere else?
Yes, so actually this was before I was a pharmacist. I was a technician. So I floated retail for my summers. So a lot of just face-to-face with the patient, doing the usual dispensing, ringing them up, managing the inventory there. And as an intern, I also worked in a non-sterile compounding facility, and the majority of what I made there were creams, so like pain relief creams to a patient-specific formula that the pharmacist at the time would write up.
Okay, very good. Now, Ms. Estrella, what about you? What type of field are you working in now?
Right now, I am still, I'm just doing home health services, specialty pharmacy. We're just doing the specialty medications for infusion. So basically, my role now is just coordinating the schedules of the patient and the nurses, and then keeping track of inventory and doing the purchasing.
And trust me, it is a big job, for pharmacy technicians like that. You've also worked in home infusion,
Yeah,
right?
I did home infusion for most of the 16 years. I did also compounding of specialty drugs, antibiotics, chemo, and TPNs.
Chemo and TPNs, right? Oh, and those for those of you who are not familiar, when you do compound chemo, that takes a special kind of room, right?
Yes.
Okay,
Yes.
can you tell me about that?
When we have a clean room, the main purpose of a clean room is really to keep the preparations from getting dirty, right? So we want to keep them clean, and the focus is always the patient, of course, but we want to keep the medications clean so that they're not contaminated, the patients don't have any negative outcomes. Now, when we compound a hazardous medication or a chemotherapy drug, there's an added element to it. Is like, for example, Miss Estrella, when she has to make it, we have to ensure her safety as well, that she does not get exposed to those agents, because they can be toxic.
Detrimental, right?
Yeah, in large enough quantities. Similarly, we have to protect the operator, but we also have to protect the environment, right? The release into the atmosphere of these drugs. So for that, we have to build a special room that is under what we call a negative pressure. So there's an exhaust system, very complicated engineering, but basically think of it as a big chimney. That's constantly sucking air out, and you work in that environment with your hands and your preparation in that environment with a vacuum that's constantly taking the air out, so that way there is no fumes, making contact with you, the operator, and those fumes are all constantly being taken out of the room and run through a filter for decontamination before the air is released back into the atmosphere. So there's an added element of engineering there. And for the operator like Estrella, when she has to go in there, she will have to wear extra set of gear. So another hazardous gown, extra headgear, double pair of gloves, chemotherapy rated gloves, and that's just to prevent any accidental exposure to herself, because we don't want that to happen. So it does make maneuvering inside the hood more cumbersome.
Right.
If you have to use, a lot of facilities use iPads and electronic devices today to do medication checks. Well, if you try and operate an iPad with 2 pairs of gloves on, your touches will not register. Right? So that's that. And then when you try to push tiny amounts of drugs on a syringe with 2 pairs of gloves on, your dexterity is also affected. So there's a whole element of maneuverability, dexterity that is required from the operator on top of that. So a lot of diligence and attention required.
Very good. So you said something about protecting the operator, which is like those who compound. What about for pregnant women? Do you allow them inside a biohazard or a chemo hood?
We prefer not to. So any employee, I'm assuming at any facility, will have to sign or review a disclaimer that, if they have to work a certain position, they may have to work with hazardous drug. So it's a disclaimer. So if they don't want to, if there's accommodations that need to be made for them, then they need to voice that at the moment. And if they agree, then they will have to go through the proper training on how to use the gear. So again, the gear and the regulations that dictate the use of the gear and the engineering controls are there in place for that to prevent the accidental exposure. But for pregnant women, or childbearing age women, I should say, the recommendation is usually to try and keep them away from that kind of workflow.
Yeah,
And then see if there's somebody who would like to volunteer instead, and that would be the ideal situation.
Okay, great. So the pharmacy board basically regulates all of the stuff, right, for each state. And of course, each procedure that you guys do, you have to have a competency, right? So is that regulated by the board, or is it by the facility that you work in at?
Ideally, there should be records on both. You should be checked and made sure that you can do all the steps to the standard of the board. And then the facility has its own standards, and when the board comes in, they will check the facility standards, make sure that every compounder has been at least annually not certified, like rechecked, make sure they're competent, make sure that they follow the procedures of that facility, and that those procedures are adequate to maintain, sterility and all the board requirements.
Yeah. So the standards, the regulations are established by this organization called USP. So that USP stands for United States Pharmacopoeia, and their role is to basically create and update and maintain regulations concerning we're talking about this specific field of compounding, in order to protect the patient, ensure that quality preparations are made, and protect the patient from any potential harm or contamination of the preparations. So those regulations are published on a nationwide level, and then each state board will take these regulations and enforce them at a local state level. So they will go into each facility and say, okay, so this is what we should do at a national level. We want to be stricter here, so we want to see this happen in our state of Nevada, and let me see how you guys are doing this. They'll go in the facility and hold you to those regulations. Yeah.
Well, what about on the retail side? Like the retail, I'm talking about like the pharmacies that provide the public with their prescription oral medications. Is there a lot of guidance or competencies involved in that as well?
Yeah, I mean there's a federal register. There's different, because we also deal with controlled substances in the outpatient setting. So the DEA is involved at a regulatory level here, and the local boards of pharmacies also do have state-specific laws regarding dispensing in the outpatient that have to be followed. How many doses can you give to an outpatient patient as an emergency? Is it 24 hours, 48 hours, 72 hours? Are you allowed to do emergency controlled substance dispensing in the outpatients? There's a lot of regulations at a local level here too.
Yeah. Okay. Yeah, well, that is another topic for another podcast, actually, because that's really good. So a lot of regulations that y'all have to follow in order to practice. So what is your favorite area to work in the areas that you have worked in? Let's start with you, Mylan. What's your favorite and why?
Well, I'm right where my favorite is. Like, I love home health, and most of my experience is home health. I do purposely try to stay within this niche because I do enjoy it. And yeah, I just have no reason to move from here.
Yeah, that's good. I enjoy it too. That's why I'm in the home health division too. How about you, Vincent? What's your favorite?
Well, I do like the technical aspect of things of fields in general. So I think sterile compounding is where I tend to gravitate towards, because there is almost like an engineering microbiology element to it that you don't learn in school, in pharmacy school, that you have to kind of learn as you go and on the job. And when the HEPA filter in the ceiling breaks down, what do you do? Those are things you don't learn in school. When the hood that you operate in has a problem, how do you fix that? Or when you build a new clean room, how are you going to organize the workflow, the hoods, where are you going to put the pass-through? Those are things that you don't necessarily learn in school, and that tend to like.
That's your
Yeah.
most favorite. I know you, and you're really a technical person. What about you, Estrella? What is your favorite area to work in?
I think from all the responsibilities that were given to me, it's the compounding side.
The compounding side,
especially
okay.
the mixing of the TPNs.
Oh,
Like what I
okay.
always say to the other technician, it's like baking
Ah,
because you have to be exact in everything.
you have to have the right ingredients and the right
the
measurements, right? That's really cool. Let's see. So, what are your biggest challenges in the pharmacy field, in pharmacy right now? I know there's a lot of challenges. Would you like to talk about, say, I know one of the challenges is shortage of medications right now.
Mm-hmm.
So, do you have anything to say about that and any other challenges you have at this point?
Well, at least where I'm at right now, shortages haven't been too much of an issue, and we do keep ourselves pretty well stocked when it comes to supplies, at least. So that hasn't been an issue, but because I do dispense a lot of specialty meds, the biggest barrier tends to be whether it's approved by insurance. So
Oh,
we have a great intake team that figures out ways to get the patients what they need. When the insurance is pushing back, they'll assist the patient or even do it themselves to appeal and get the doctor involved when necessary. Look for financial hardship programs so that our patients can get the medication. But it is our biggest barrier, at least, is to get the patients able to, or get the insurance to cover these specialty meds for the patients.
yeah. Can you name some of those specialty medications? I know
Yes.
there's a lot.
They're not very commonly
They're not very
dispensed.
common,
Yes.
correct, right.
Like we dispense a lot of immunoglobulin meds.
Right.
So those can be like Gamunex, Gamagard,
Your IVIGs.
Izentras. Yes,
Uh-huh.
IVIGs. And then we dispense Remicade, Entyvio, Fabrazyme, like those types of medications for chronic conditions. Yeah, these sometimes can run up a bill quite a bit, and sometimes they're not the first line for the condition, so the insurance would want the patient to try this, try that, preferred brand because it's cheaper for the insurance is in some form to for the patient to
For the
try
patient,
these first.
right.
Yeah. And that can be frustrating sometimes because it could take weeks going back and forth with the insurance, and the patient can get frustrated because
Yeah.
the doctor prescribed this and has told them they need this, but why did they have to try something else first? So that's a little bit hard to explain and to weave around.
Yeah, and with your one-on-one talking with the patients, the both of you start getting frustrated, when you say, I'm sorry, your medication hasn't been approved yet, so what do? You can't really, your hands are tied.
Yes, and
yeah.
the doctors get frustrated at this too because, we all want to service and get the patient what they need as soon as possible because sometimes they are currently suffering and you want the symptoms to stop, but these things can delay the treatment for quite a while.
Yeah, and the other challenge to that is the patient usually has a high copayment,
Yeah.
right?
Yes.
And a lot of times they can't afford it.
Yes, and we do try our best to look up extra third-party programs by the manufacturers or by just anywhere that could help support these patients and cover the parts of the copays that the insurance does not. But sometimes there are very stringent requirements for the patients to qualify for these programs, and occasionally it does not get covered and the patient can't afford the copay even after insurance. And in those cases, very unfortunate, but we cannot service. And it's always, it hurts to have to say no.
Yeah, that's true. That's true. Yeah, huge challenges in healthcare. What about you, Vincent?
So Mylan said she doesn't see the back orders or the supply problems too much in her field. In the hospital, I want to say that we do. So if you'll remember, there was a tornado a few weeks ago that took out a large manufacturing facility in the Carolinas. So, it doesn't affect the hospitals at that moment. But remember that the manufacturers are going to send their drugs to distributors, and distributors are going to stockpile and then, start liquidating those stocks. Then 2 or 3 months after the disaster is when we start seeing in the hospital supply chain issues. So there's natural disasters. So that incident I talked about, there was a hurricane that took out Puerto Rico a few years ago, and that was huge because Puerto Rico
that was huge.
Yes, you saw. I believe you experienced it too.
Yes.
Puerto Rico, the facilities there make a lot of diluents. So we're talking about saline bags, dextrose bags. So what do you do if you are not able to get dextrose bags and saline bags, and you have to piggyback a patient, right? Give a drug via piggyback to a patient. Maybe you switch as much as you can to IV push, but there's only so many drugs that you can IV push.
Correct.
Right. So there's natural disasters, there's supply chain constraints that we saw with COVID. So whether it's the raw material or there's not enough ships to take the stuff around, we are in an increasingly more globalized world, and our there's a lot of drugs and medications are made in
other
countries, all parts of the world. So what do you do when that shipping, those shipping
Gets
lanes,
stalled,
are
right?
stalled, disrupted? There was a Suez Canal blockage a couple of years ago where nothing could travel from Asia and Europe into the States here. So we do see a lot of supply chain issues, at least in the hospital. Right now it's ongoing. So there's drugs that are in and out of backorder all the time, and we do have to dance around those shortages and you can't plan for backorder, but we almost have to plan for it and stockpile what we can, and come up with measures in order to not run out of diluent, not run out of medication. And sometimes we do. Sometimes, to the best of our abilities, we still run out, and we have to deal with it right there, right then.
How about as a pharmacy technician, Strela, what are your major challenges right now?
I think the same as what Mylan said, other than the shortage of the supplies, is with dealing with insurance and explaining it to the patients, since we are the ones calling the patients, setting up the deliveries, and then we're the one informing them about their co-pays, and then they start questioning about it. So that's one of it.
They start getting mad as well, but it's understandable. But yeah, that is a big issue in the pharmacy field, right now. So I'm not sure if you want to answer this, but according to CNN, employees at two of the largest drugstore chains in the United States say that they have harsh working conditions that make it difficult to safely fill the prescriptions, and they're about ready to walk out or what. Have you heard about this, and what's your opinion on it?
Shortage of staff.
Yes.
I think for the retail, really is the toxic.
That's a challenge.
Yeah, it's a challenge. Up until recently, some I'm not going to name anybody, but some retail companies did not have mandated break times for their pharmacists, meaning a pharmacist could work 12, 14 hours in a row without having a mandated break time, meaning that they had to be present during those 14, 12 hours, 10-hour shifts in the pharmacy. So recently there was a break time that was instituted. Finally, there's also the question of pharmacist to technician ratio. So, and that's a question. I'm not siding on any side, but the question is, if you have one pharmacist and 3 technicians in the pharmacy, how many technicians should a pharmacist be able to supervise? Is it 3 technicians? Is it six technicians? Should it be 9? Should it be more? And then the more technicians you add, the more responsibilities you add onto the pharmacist.
The pharmacist,
right? And then the less technicians you have, then the less help.
But there's more work for you.
Correct. So there's a balance that we need to strike between being efficient and being adequately staffed, but also remember what we're here for, being able to service
Service
to
to
the patient and do it in a safe
in
way.
a safe manner.
Yeah.
Right. And that's, I think, also similar to the nurse-patient ratio that we are also, seeing these days. So, good. Okay. Well, it definitely is a challenge, and I hope, they all rectify this issue. Mylan, I have a specific question for you. What do you think about the declaration of Women's Pharmacy Day? Are there more women pharmacists now in a leadership role, and would you want to be in that role someday?
Well, I believe the amount of female pharmacists is slowly increasing to the point where there are more female pharmacists up in the schools than males sometimes. It slowly moved up to 50-50, and in my year at least, there were more females in my class than males. So it has become an increasingly female-dominant field. I'm sure Vincent is working with a lot of female coworkers as well. Mm-hmm. So, yeah, it's a pretty good field for us. I feel like it's a kind of a supportive role that suits a lot of our, tendencies. We like to take care of people, and it's just a good role with good schedules mostly. I mean, except maybe if you work in retail, you might have long hours, but they tend to be day hours. So it works well for family to be home at night.
To be home at night, right.
Yes, and take care of your family as you need as well. As for whether I would like to go into like a more leadership role, a pharmacist's role is already innately pretty, you are a leader of sorts already, because you do have to, you're the cornerstone of a pharmacy, and you have to make sure everything flows the way it should. You have your techs to allocate to each job, and even though of course there is a hierarchy like in any field, a pharmacist's job is innately already involving a lot of leadership. If I don't really want to climb from where I am right now, I'm pretty comfortable as it is. But, maybe in the future, once I get more experience, that is something I would consider.
Very well put, Mylan. Thank you. Thank you. All right. Well, one last question. Do you have a message to the public regarding our current healthcare or regarding the pharmacy profession? Let's start with you, Estrella.
For those people who are wondering or are thinking of going into the pharmacy tech program or being a pharmacy technician, it's not just counting pills. There are other fields that you can enter. And then if you're thinking whether you really want to go into become a pharmacist, it can be a stepping stone. Like, you can have a feel of how the different responsibilities go. And then you finally decide, I want to be a pharmacist.
Yeah. That's good. What about you, Mylan?
I'm sorry, what was the
message to the public about your profession, and if you want other people to get into it?
I would recommend that it is a very good profession to be in, but it's not in demand as it was years ago. So people used to hype the pharmacy job up very highly because it's in demand. People were getting sign-on bonuses and everything. So, and in my community at least, where it's primarily Asian, these types of jobs are very well seen by both your family and those around you.
That's true.
Yes. So I think it's a great career, a good work-life balance in general, depending on where you enter. But it could be overhyped sometimes.
True.
Yes.
Okay. Well, what about you, Vincent?
I do have two messages. So to those who are considering pharmacy as a profession, as a career, whether it's pharmacy technician or pharmacist, I would recommend that you try and shadow somebody in that field for not just a day or a week. I'm talking about a few months at a time, so you can see if it's really something that you want to do, and try different settings. I know there's outpatient, there's hospital, there's home infusion, home health. There's even nuclear pharmacy, which some of my friends have been doing. So, try and shadow somebody in that field, And then number 2 is remember that we are in this day and age where AI and you know, we are even more and more reliant on computers to support us in doing our job. So, you know, everybody's talking about the rise of AI. Oh, is AI going to replace pharmacists? Well,
Yeah.
I think, you know, that's a tough question to answer, but my take on it is you still have to have a human component, you know, to the element of healthcare. I'm not just talking about pharmacy, like healthcare, right? So somebody has to make the decision and be accountable and responsible for the treatment decision or the dispensing decision or the administration of the medication, you know, decision. So I wouldn't be afraid of AI in that field, but the more you specialize in your field, so if you're compounding, if you're doing, you know, all this manual skill stuff, then you are more likely to be, you know, protected and protect your career and then kind of keep your field safe from the, you know, the AI or the computers taking over. I hear that a lot. So that's my message for the potential people interested in profession. So don't be scared. It is a rewarding profession. The second message I have for the general public is take care of yourself. And I mean that by, yes, healthcare practitioners, Doris, you are here. We are here to help that, but it also starts with, you know, people in the home and their communities taking care of themselves and each other. And
Self-care.
Self-care. So, you know, whether it's exercise or watching diet, what you're eating, and ensuring you get enough exercise, that can go a whole lot. You know, we are here to help the community, but sometimes it's better if you don't even see us. Don't need to see us.
Yeah, you're
Respectfully.
sort of like in the background.
Respectfully.
Yeah, that's true. Well, thank you so very much, Vincent Nguyen, Mylan Dao, and Estrella Palispis for coming to our program today to give us an insight into the pharmacy world and or the world of pharmacy. So thank you so much for all you do. And of course, in full disclosure, I used to work with all these 3 people. So I just would like to say that I miss those days when we all used to work together. These are some of the hardest working people that I have known. So thank you again, you guys. I miss you guys.
Thank you. Good memories. Thank you.
Yeah, thank you very much. And so to our listeners and viewers, we leave you with this. The pharmacists play a critical role in the medical community. They dispense prescription medications. They ensure that patients have what they need to feel better or to get well. Pharmacists also act as counselors, advising patients on how to take their medications effectively and safely. And many pharmacists also do more. They might offer blood pressure monitoring services or administer vaccinations and handle cholesterol consultations, and a lot of times do volunteer work out there in the community. And this is just to name a few. And pharmacy technicians provide a valuable assistant to the pharmacist. Like Estrella said, they are their right hands. So they also make invaluable contributions to patient health and safety as an integral part of the pharmacy team and the healthcare team. So because October is National Pharmacy Month, please take time to thank the pharmacists and the pharmacy technicians out there. Thank you so much for all you do. And thank you for listening and joining us today. Thank you for giving us the privilege of your time. This is Doris Bauer, your FILIPINARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FILIPINARS, news and features about the Filipino-American nursing community and beyond.